Assalamu alaikum. My name is Dr. Bushra Zulfiqar and I'm working as a professor in Sir Syed Medical Girls College. Today we are talking about the bacterial vaginosis. As you all knows that it is not a type of infection, it is just a disbalance between the normal vaginal flora and the abnormal vaginal flora. And because of this abnormal vaginal flora, what happens? The pH level of vaginal secretion is increased. So what's the beauty of this drug which was called Womeno is, it is not an antibiotic because this disease is not needs basically antibiotic. This disease needs forming the balance between the vaginal flora, and we are in the vaginal flora normal there is lactobacilli, as we all knows that lactobacilli is a normal vaginal flora which was imbalanced by the presence of anaerobic infections like Gardnerella vaginalis and all that. So the beauty of this drug is that it is not causes any type of uses as an antibiotic, but it is just enhance the pH by raising the lactobacilli. So what happened in the bacterial vaginosis, when the lactobacilli are decreases, we are given the antibiotics which kill the Gardnerella vaginalis. And this Gardnerella vaginalis kills with normal lactobacilli as well. What happened? Lactobacilli decreases, Gardnerella vaginalis decreases, and what happens? The inflammation is subside for a time period. Then again it occurs. So the beauty of this drug is it increases the lactobacilli, forming the normal vaginal flora, and it's easy to take in pregnancy, in menstrual period. There is no use to insert in the vagina. This is oral drug. मेरा ख्याल है इसलिए ये बहुत अच्छी है इस डिजीज के लिए और हम अपने पेशेंट्स को दे भी रहे हैं, and the patients have very healthy results after using the Womeno. Thank you.